posting those words.
When you testified on direct about having COVID when you were served with the summary documents, but you said you had it for a second time.
Correct.
I thought, is that what you said?
Yes.
And I'm wondering when you had that, because you talked about, during the time of the pandemic, going out to visit families in their homes and not wearing a mask because you felt like you wouldn't get sick.
No, not wearing a mask or not doing that because these are people that were literally thinking, I'm going to die. And all they're seeing is people that are afraid, like their spouse is upstairs and they've been on the couch by themselves. And if you look at the data on the vagus nerve and the GABAergic pathway versus the glutamatergic pathway and the importance of our parasympathetic nervous system in healing, and you can go in there and you can give them, and you can take some of that fear away from them and give them hope, it's transformative in their ability to heal. I wasn't like, listen, I highly, highly, highly respect this virus. I'm just not afraid of it because I have...
When you were ill, when you had...
I wasn't ill.
When you had COVID versus went into these people's homes, had you already had it?
I had it first time in December of 2020.
And then when was the reoccurrence? October of 20?
October 9th of 2021.
And do you recall in a meeting at your, in a church building that you hosted?
I was asked to join.
That you were speaking about having gotten ivermectin for yourself, and you referred to having, and that you got a drug that shall not be named because of an intestinal parasite you had, and then you and the crowd began laughing. What was that about?
You've got a benign, if you will, right? Like Tylenol scares me. The amount of people, not scares me, but if you're going to look at things, the amount of people that damage their liver or teenagers that are going to pound something and damage their body, and you think like, what's probably not going to happen? Like, what are the least of these that are going to have a negative impact, right? So it's like, even if it was, let's just say it was placebo, even if it wasn't effective, the likelihood of negative impact, taking 0.2 mg per kg of ivermectin versus the need for dialysis after remdesivir, and the politicization of it, because the medical community, like the people that were treating outpatient, right, that weren't asking for somebody else to tell them, hey, what can I do? The people that were actually, that when people came to them and they were desperate and they're like, well, so like there weren't journals, right? I didn't have any journals to look at because there was no data. So I started looking at how the virus affected the immune system. And I was like, okay, well, what things can inhibit interleukin-1 beta and tumor necrosis factor alpha? And, it's like medicine, right? You're studying these mechanical pathways. They picked tocilizumab because it's an interleukin-6 inhibitor. They didn't pick it because it has a benefit for the cytokine storm in COVID, because the cytokine storm is comprised of about 6 different potent inflammatory markers, and tocilizumab only affects 1. So how are you going to knock out the cytokine storm when you're only blocking 1 inflammatory pathway when there's like 5 others that are just destroying the lungs?
Scott, can I just, sorry, for the benefit of Lori and everybody, please do your best to slow down.
Yes.
Sorry, Ms. Brewer, just wanted to.
So I think we were laughing, or I kind of laughed. just as, like if it was a child with, a family and they had a mom brings her child with autism into the clinic and they have a 15-month wait and I have two options. Say, well, I apologize, or like, oh man, that's a bummer. You have bad insurance. Or I think if that was my son or my daughter, what would I do? What would I do to just something to see if I could figure out how to, okay, what's the role of the, like the glutamatergic pathway in autism or, so.
I'm sorry, but do you recall that my question was about you laughing about your own prescription, that you didn't call ivermectin and you got it for?
Yeah, my point is, if something is, my point is this. Something was politicized and demonized. The FDA put a picture of a doctor with a stethoscope listening to someone's lungs and then a picture of a horse on the FDA, on their website. I don't know what that is, but when you have all of these memes and all of these like incredibly intelligent people willfully ignoring, if nothing else, the negative, like the non, the benign nature of this medication. So when we say that which is not named, right, and we're laughing about it, it's like we can't even say it. It's like Voldemort. Like, this is science. This is medicine. Like, we should not be attacked for using medications to treat people.
Did you also say at that same event on October 9th, 2021, I do write medical exemptions. They will get my license, but for now, I will give it to anyone who needs one. They will eventually get my license, but until then, I will write one for anyone who needs it.
Did I say that?
Yeah.
A medical exemption for what?
That was, I'm asking whether you said that. I don't know what you meant for. I'm not the speaker you were.
Over the last 14 years, I've written many medical exemptions for people that required one.
So at this discussion that was about COVID-19, you weren't referring to medical exemptions for masks? Is that your testimony under oath here today?
I'm pretty sure that that wasn't excluded.
It wasn't excluded?
Discluded. I'm pretty sure that if there were people that my wife running to get on the airplane, and she gets in the seat, and I've never seen this happen, but she started like hyperventilating and then gasping for air, and we got an airline attendant, and sadly their 911 kit didn't have anything that was beneficial for what she was dealing with. Well, they had something, it was just off label. And thankfully, I had studied enough to realize that it had a secondary effect on an antihistamine pathway. But there are, people that are in need of an exemption for something that without it is going to limit their ability to function in society. Well, yeah, if there's medical necessity, why would I bar them from that?
And then as to the date of that meeting, October 9th, 2021, I think you said the first time you got COVID was December 2020, but the second time was October 2021, so that overlaps the date of this. You were the one of the speakers.
Say that again, please. I apologize.
You testified you had COVID the second time on October 9th, 2021, and October 9th and 10th, 2021, and this,
So it was
let me finish the question, thank you. Where you attended was October 9th, 2021.
I had initial symptoms at around 10:15 on Sunday night. So I would need to look at a calendar to see what day Sunday was in October.
I believe the meeting was on a Saturday.
So yeah, it was October 10th. It was a Sunday night.
The meeting,
So,
you got COVID.
pardon me?
Sorry, are you saying when you say it was when you got COVID or the meeting?
I tested, I had initial symptoms on October 10th as I was eating dinner, and I started having visual disturbance, and I was like, that was weird. And it was just hit like out of the blue, and I had a hard time standing up walking, and my wife tested me and it was positive.
Okay, but I thought your testimony was that the second time you had COVID was October 9th and 10th, 2021. Not just the 10th, so maybe I misheard your testimony?
Or I was mistaken in the date, since I apologize, I didn't have a calendar up. I didn't know that the day was relevant.
When you spoke at the school board meeting, how big would you say that the attendance at that meeting was?
Maybe 18, like the chairs were spaced apart, so 18 to 25 people, 20 people.
And was that meeting also broadcast for people so that they didn't have to come and wear a mask or to limit distancing? Do you know?
I had never been to a school board meeting. I didn't, I don't know. I had never seen a school board meeting. I was just asked if I would come and speak.
And when you testified or spoke at the school board meeting, you introduced yourself at the outset as owning a pediatric practice, and we've seen the video of you there. You said you explained to them about these kids in your practice who were criticizing their peers for not mask wearing. You were upset about that. Do you recall that discussion at the school board meeting? And you've talked about it more throughout this hearing.
Yeah, like I will occasionally sadly criticize my wife for not like closing the door or a drawer. These kids weren't being criticized. Their lives were being threatened.
And you, in response at this meeting, said that you had showed this kid pictures of you out and about with your friends in indoor settings, not wearing a mask, and socializing normally, right?
I mean, that sounds like something normal people do, so yeah.
Did you tell the people that you were making that presentation to that you actually had a mask exemption?
Did I tell the people in the room in the school board?
I didn't hear you say in that presentation, and I showed these pictures of me with my buddies in a bar, and I wasn't wearing a mask, but you didn't say, of course, I have a mask exemption.
Nor nor did anybody else have a mask on.
No. My question was, did you tell people that you had a mask exemption? Anywhere in that school board meeting, because I didn't see it.
Did I broadcast it?
Right, you're not wearing a mask, but you don't disclose that you have a mask exemption.
I don't disclose what vaccines I've been given or my lab results.
Did you write your own mask exemption or get it somewhere else?
In the context of not wanting a provider to get in trouble.
I'm not going to ask the name of the provider. Was it you or an outside provider?
Outside provider.
And you wrote masks for your children. Are you their
Yes.
provider?
Yes.
And you talked about vitamin D labs on 2,000 patients, including kids. Is getting lab work on all your patients a regular part of your practice? Lab work on kids, like how often do you do that?
In general, no. For an otherwise, or should I say, in an otherwise neurotypical child, no. My practice was, it became a far more specialized practice where I would get lab work and I would add vitamin D because I was getting, zinc and copper and, other labs. And since we should know or know that, I was seeing children on the spectrum with vitamin D levels of 6 and 9 and 11. That's so devastating to the foundation of the body that to not have those labs would do a disservice to my ability to help them. So I could have excluded it, but then I would have had to apologize for why I chose not to thoroughly do a workup. And they'd already been failed by everybody else. So I was like, I'm not going to fail them.
Understand. And I'm sorry to skip around, but that's kind of how
It's okay.
How did you find Dr. Schwelt? I think it was Schwelt, and I think you said he was a dentist. I think you really need.
No. He's a quadruple board certified physician.
So how did you find him?
Google.
And I'm sorry, to go back to vaccine exemptions, can you tell us how many vaccine exemptions you wrote?
For what?
Mask exemptions for children or adults to not have to wear a mask during COVID-19 to go into a space that required a mask.
Just for clarification, do you mean like a restaurant?
Yeah, I mean an exemption. I don't know what the person needs the exemption for.
No, my curiosity was like if they needed it to stand in line or to sit down and not wear it.
You seem to be the expert about mask exemptions. Maybe you can tell us about what you wrote and what they were for and what the distinctions are during the pandemic.
I had, and I can't tell you exactly, but I had so many children that they couldn't get their hair cut. They had to figure out, moms had to figure out what kind of socks to get because if they had a line in them, they would lose their mind. The jeans, the jeggings, the way the clothes fit, the food, the sensitivity. So I had a shocking number of kids that if you try, you can put it on and then spend every second of your day putting it back on, and dying on that hill all day. So yes, there were families that I said the risk benefit of because it's switched, right? It used to be that a child that was 49 months, 49 months, 29, 30 days didn't need a mask, but the next day on their birthday, they needed a mask. And I was thinking, I don't understand that. The day before they didn't need it, Klaus, the day before they didn't need it, but today, happy birthday, here's your mask. And I was like, and I desperately sought the science of why the next day they needed it. And then they moved it to 2 years old. And I'm thinking, yes, 2-year-olds are very compliant. They're very CDC and WHO compliant with the mask. I think that's fantastic to have them do it as they're like putting their hand in their diaper and then touching their mask. And so when they were 11 months, 30 days, they didn't, or 23 months and 29 days, they didn't need it. And all of a sudden they turned 2 and it was like, oh. So I was looking at the science of how they determined that. And I couldn't find it. It was nowhere. There was the mandate, but there wasn't the science behind it. And so when a mom would ask, why does my child have to wear a mask tomorrow but not today? I was like, I don't know. So I have to give informed consent. I have to give scientific reason for why I say things to people. I'm sorry, I apologize. It's like I can't just say things because somebody told me to say it. They're not going to trust me if I'm just going to blindly say something one day and then the next day switch it because they're a day older.
By September of the time period of July to September of 2021, which is really the time period that we've talked about in terms of the patients A group. In addition to studying the FLCCA protocols, and you said you did study those and that you admired Dr. Corey and Dr. Merrick. By then, had you read the available peer-reviewed literature regarding ivermectin?
If we just simply took ivermectin off the map, just literally there was no such thing as ivermectin, I'd be grateful. I mean, apart from its benefits in post-COVID, if you wiped ivermectin out of the entirety of it, hospitals did not have it on their formulary. The thing that I was worried about is if I had a severely ill patient and they said, I don't tolerate steroids, and I think, holy cow, I don't know how many nights I went to bed thinking just, okay, Lord, get them through tonight as their immune system change goes in and they're going to go into that inflammatory phase and they're going to call 911 at 3 or 4 a.m. It wasn't the ivermectin that mitigated that, right? I mean, sure, it's helping like block the ACE2 receptor in the lungs. Yay, that's awesome. But if they're day 8, 9, 10 and viral replication is over and they're into the inflammatory phase, it's going to have benefit, but without the anti-inflammatories and antihistamines as they go into mast cell activation, I'm not reliant on ivermectin. I didn't ask patient E. So patient E, right, and we were given, I can't say his name, but the son.
Slow down, please.
Okay. He said,
slow.
Is it worth giving ivermectin, like pushing forward with it? And I said, no. Not if they're not going to do other things. Ivermectin will not save your dad's life. If they don't do these other things, right? Like I didn't, the people that I was able to collaborate with, the providers that I was able to collaborate with that made myriad of changes, like added montelukast and IV thiamine and cyproheptadine and nebulized budesonide and nebulized acetylcysteine, right? If I was calling and saying, give him ivermectin and everything's going to be fine, I'd be embarrassed. And I mean, I wouldn't even, like, we wouldn't be having this discussion because you would be able to just tear me to shreds on the science.
So my question was about the peer-reviewed studies, but can you tell the panel the number of vaccine exemptions you wrote?
For who?
Anyone.
In what time frame?
Exemptions from the COVID-19 vaccine during the time period starting when the vaccine was available.
Yeah, I don't need to object to this line of questioning. This is not the subject of, I believe.
Can I answer it?
No.
No, hang on.
Any of the statement of charges, and it's opening up a whole new avenue. It's beyond the scope of this hearing, I believe.
Judge, it goes to cross-examination because he said he really isn't against the vaccine. He's made a lot of statements engaged in conduct that I think contradict that, and I think I can ask about that.
If it's relevant, Your Honor, that's one thing. I just don't see the relevance, but if Mr. Miller is able to answer.
I'm sorry, I do, at least for purposes of cross-examination.
Very good.
The questions are not going to result in additional charges to him. So, Mr. Miller, help me out here.
Yes, sir.
Do you know the number of mask exemptions you wrote during the relevant time period?
I think she said vaccine exemptions.
Oh, no, I understand.
Oh, sorry. Okay.
I do. Do you have a number? Do you have a range?
A couple hundred.
Okay. The next question was about vaccines. During the time period that you were treating patients and the vaccines were available, how many vaccine exemptions did you write? Give me a range.
For my practice, for the pediatric practice?
Yes.
None.
What about the adults that you treated? An approximate number.
2.
Thank you.
Maybe 3.
Thank you. Ms. Brewer?
Yes, you testified about the FLCCA protocol and the number of patients you treated on direct. And there were statements about 900 patients, 300, 600, but in your testimony today, you said you'd actually treated many, many more people with the FLCCA protocol. How many people are we talking about?
Well, I was unaware of the FLCCC protocol until December of 2020. I was and mind you, I didn't know that treating people that came to you that were sick was forbidden until like spring or summer of 2021. I mean, I didn't check like the guidelines of what we were allowed to do to help people. It wasn't until pharmacies started blocking things, I was like, what's going on? That was like June or July of 2021. So from say like April 9th of 2020 to, you know, July or August of 2021, I was just simply, no, probably June or July, I was just simply helping people. And then that one medication became just this hyperbolic thing. So
I'm not asking just about that. I understand that the protocol was many other things, and not just ivermectin.
no, my point is I wasn't doing the FLCCC. It was because that's just, the hospital has a protocol. I treated patients. I listened to each one. I went through their history and their comorbidities. And then based on that and knowing what I know, I've spent a shocking number of thousands of hours studying this and over 3,000 phone calls talking to people. So this was not, here's a cookie cutter thing, because everyone is different, which is what really threw my office off, because they never knew what I was going to do. So my point is, I didn't have a protocol. I had a standard of things. Like everybody, I wanted them to have medications in case, because if they hit day 8 and they don't, and they're an emergency, a lot of people die not having those. So I apologize. What was your question?
Yeah, I'm trying to get a sense of, you are listed on the FLCCA website as a person in Washington that patients can go to. That information, I think, is widely disseminated. And you've talked about how busy you were and how many patients you
talked about it earlier.
tried to. Am I being recorded somewhere else?
I'm not sure what happened there.
No, somebody came in with a phone
No.
call.
Yes, I was trying to mute it. I apologize.
No, Jen, that's fine. Thank you. Ms. Brewer, proceed.
I think you're jumping ahead and assuming the purpose of my question. What I'm trying to get a sense of is to treat 900 people, 900 patients, and take a history and do all the things that you said you did, would take an inordinate amount of time. And so if it's 900 patients, at least, maybe more, I'm trying to get a sense of how many more.
My wife cautioned me to answer this because one of the wives of the patients wrote a letter, and it was to me, but it was to my wife, where she said, you need to imagine that your husband is deployed. She had 4 sons that were deployed, and she said that even though he's local, you need to understand and give him grace if he can't be there for you, because LJ Raleigh said it, 900, that's impossible. In an outpatient setting, that's impossible. And what I said at the church is like, yes, it is, or seemingly. And if it was only that, and I was like, that's one man acting as one man, and that's and where you hammered me for saying it was like, I didn't pick it. Like, I wasn't like, this is going to be fun. This is going to be awesome to do. Like, I want to ignore my family. I want my son to say, Dad, if I get COVID, will you pay attention to me? Like, no. And it certainly didn't increase my wealth. It didn't allow me to continue to serve my pediatric population. So how did I do it? With a shocking amount of imbalance and God carrying me when I was so tired that there was no possible way I could take another phone call. I was so exhausted that I was like, am I going to make the right decisions? I shouldn't answer the phone, except I didn't answer the phone for Melissa, and she took Roger to the hospital, right? Like, if I miss a phone call, people died. And so I was like, I can't not answer the phone. So how many?
Yes, I still want to know how many total.
Why? What's for what purpose? To attack me more?
Mr. Miller.
I'm,
Mr. Miller. We're in day 4. We're all tired. We all want to get through this and give you a fair hearing.
yes, sir.
In these hearings, with respect, you don't get to ask the questions, you merely get to answer them. So let's try that.
I apologize.
Ms. Brewer?
And I will follow up with the comment that it was your counsel that elicited from you how many you had successfully. How many were they? What countries or what states were they in? And what was that list? And you didn't come back to answer it. I'm wondering. It was directly asked of you how many patients and what states were they in?
Acutely ill?
How many overall with the call?
And I'll just note an objection under just for characterization. The question in that regard was with regards to how many patients that he advocated for that were in the hospital, and then the different states, and how many in Washington. There's other questions about other topics about how many actually treated, but that specific question that she just alluded to outside the state and so forth, that had to do only with people in the hospital.
Okay, let me say this. There have been a number of figures given in this hearing attributed to Mr. Miller providing treatment. The number varies. They're usually pretty high. When you say treatment, do you mean, Mr. Miller, that you created treatment records for all of these people?
Anyone that received... May I ask a question?
You can ask me a question, yeah.
Okay. You said that, so that...
Well, let's try this. For any of these questions to make any sense to me, and hopefully to this panel, we all have to be speaking the same language. Now, what I have heard you testify to is that you were taking phone calls from pretty much anybody who called you to try and get some help. Is that an accurate statement?
Pretty much, yes.
Okay. So when you were taking these phone calls, did you consider that what you were saying to them was treatment?
So I would call that treatment. I didn't consider that something that if somebody said, did you, like if they didn't, if they had like a runny nose, like they tested positive for COVID and they had a runny nose, I wouldn't be like, nah, I treated them. Just that they probably, I mean, there was a ton of people that had little to no symptoms or very, very mild. It took no effort. It was like I just recommended things and sent medications for them. So I consider treatment something that required effort.
Okay, but not all of these 900 people were in what you might call your patient cohort. Is that correct?
Those are people that required effort.
Okay, so effort for you means treatment.
Yes.
Thank you. Ms. Brewer?
And did you keep a record of everybody who made effort with or treatment on the phone call?
Are they going to try? Judge, may I ask a question?
Yes, sir.
So previously, even though not a single patient has filed a complaint, the medical commission has asked for complete records, like the entirety of everyone, all of their records for everyone that I had prescribed ivermectin to from 2019 to March 2022. So the answer is yes, I have records, but I can make an estimated guess. I'm just trying to figure out if your aim is to try and get records like confidential patient records for people that requested care for some other means.
I am not opening up discovery. Okay? I'm simply asking you to explain to me, when you say treatment, what do you mean? When you give me a number, what is that number based upon? So that the commission can understand what you were doing in the relevant time period. And so that we're all talking the same language. That's all I'm trying to do.
Sure. What time frame are we talking?
I think generally speaking, we're talking June through September of 2021.
June through September. Okay. Just give me a second. Let me.
Sure.
Your Honor, may I ask what's happened? Mr. Miller has disappeared from my screen, as has his lawyers.
That is not a good sign. I cannot tell you the answer to that. Let's give them a moment to see if they can come back.
And Your Honor, when a question's pending, the break is needed, it's highly unusual to just disappear.
We don't know what happened, Jeff.
They're off the appearance list. So
Say that again, Lori.
they are off the appearance list. They literally disappeared from the hearing. So it's an electrical.
That's what I was wondering, maybe internet, because I believe they're all together.
They are. And have you, Jen, seen them make any attempt to get back into the system?
No, sir, I have not.
Thank you. Let's give them a few more minutes. I can't believe they just wanted to drop off.
Nor can I.
just received an email. Apparently there was a power outage in the Camas area. The parties are going to attempt to reconnect using their cell phones. So I'll give them a moment to do that.
Hello?
Hello?
Yes.
Hello, this is Karen Osborne.
Ms.
Judge
Osborne?
Coons? Yes. Can you hear me?
I can hear you, yes.
So we lost power. That's why everyone dropped off. Signal here is not that great, so we're trying to get phones organized so that we can get back in. So that's we just wanted to make sure we let you know what's going on.
Thank you. I did see the email. So
Okay,
thank you.
great.
Do we have a sense of the timeline?
No, we don't know yet. The outage is just getting reported. Our whole neighborhood is out.
I see Mr. Snyder.
I see Mr. Snyder.
Judge, and I hope you got my email. I'm so sorry.
I did.
emailed you from my phone. Literally everything went down, and the husband of Karen Osborne, this is their house, he said, when this happens, it happens in the neighborhood. And for some reason, we lost it. We all happen to be here. So if we're able to come back in with our cell phones, we'll do the best we can so we can at least finish up for today. Is that okay with you, Ms. Brewer, to try to do it this way?
Sure, I don't have an objection to telephonic, although I would.
I'll try to do the
agree
video.
with you that you cannot talk to your witness while I'm asking questions.
Oh, no, I am not going to talk to him, and I've not been talking to him. I'm just telling him to just try to get logged on. Exactly. I know the rules, and I would not do that. I'm not talking to my client during this. I'm just trying to figure out first how to use the bathroom with no lights on, and then try to get back in to talk to everybody. So,
Sir, that's more information than I want to hear.
TMI. Sorry, Judge. Yeah, let's try to get on log on with your phone, if your phones, if you can.
Your Honor, you never said to go off the record, so I've been like,
You've been recording all of this?
of course, you didn't.
May I ask that you redact the portion of my?
It won't be embarrassing to me, however, Mr. Snyder might take a different position on that. I apologize for not telling you to go off record. Let's go off for now.
I'm gonna open up some windows so we can get some light. I've got. So at least have some light. Did you get to log in, Pete?
The
You don't-
judge
switch to
just
data.
got an update on the outage. There are 557 houses out. There's a vehicle accident, so it's probably going to take a while for it to get restored. So
So let's try to come in on this cell phone.
See if we can make this work.
Scott, let's get Scott. If need be, Your Honor, what I'll do is I'll call in and I'll give my phone to Mr. Miller so that he can be on video. I think his cell service up here is kind of bad. For some reason, I'm fortunate mine seems to work. And I've got I've got lots of battery power, so he should be able to do it.